Hello and welcome. You're watching the News Unlocked, the show that takes you behind the headlines to the real stories that matter. At a time when the coronavirus tally across India has reported a sustained dip, one state, a state which only a few months ago was being globally lauded for its effective COVID-19 containment strategy, the state of Kerala finds its tally going up with an unprecedented surge in the number of COVID-19 cases. The state, which reported the first COVID-19 case in the country, now has over 92,000 active cases, the third most in the country. Has Kerala's COVID fight gone wrong, or are the numbers misplaced? This is our top focus. Watch this special story first from Gopi Krishna Unnithan. Take a look.
Kerala recorded more than 10,000 new coronavirus cases on Tuesday, the highest single-day count for the state so far. 4 districts reported over 1,000 cases: Kozhikode, Malappuram, Ernakulam and Thiruvananthapuram. 5 other districts recorded more than 500 cases.
The situation in Kerala is that the number of cases is increasing every day, and the doubling time is less than 1 month at the moment. The 7-day moving growth rate as well as the 30 days moving growth rate both are increasing in many districts.
The total number of infections in Kerala breached the 250,000 mark, and the death toll stands at 930. Worrying indicators for the rest of the country, as experts are now blaming festive gatherings as a possible reason for the spike. Public gatherings around Onam and complacency among people may be behind the surge in cases, they say.
The Honorable Minister of Kerala has clearly explicitly said that we are expecting a load of 10,000 to 20,000 by end of August. But still we were able to push it to the beginning of October, and we are expecting that in the mid-October or after that there will be around 15,000 cases per day.
The spike has led Kerala government announcing Section 144 of the Indian Penal Code, banning the assembly of more than 5 people across the state for the entire month of October.
It's been over 8 months since Kerala launched its fight against COVID-19. And it's the longest period for any state in the country. The southern state, which managed to keep the numbers under control initially, is now reporting a daily tally of approximately 10,000 cases. Even as experts suggest that cases could further increase in the coming weeks or months, the major takeaway remains that the state has managed to keep the death rate below 0.5%.
And joining us now is our first special guest. I'm joined by Dr. K.K. Shelja, teacher, the health minister who's been lauded across the world for her efforts in COVID-19. Thank you very much, ma'am, for joining us. Some things seem to have changed. A few months ago, everybody was looking to the Kerala model. Now, when you look at it, more than 92,000 active cases, third largest caseload of active cases in the country after Maharashtra and Karnataka. How do you respond? Do you believe something has gone wrong?
We cannot say so, because this is what we expected earlier, and we give the warning to the society, the people also. As you said, this is the Kerala have one of the longest drawn epidemics, because the epidemic started in Kerala just after Wuhan incident, that is in January 30th. And 1 month after the epidemic go to other states of India. And we can divide it into 2 parts. The first phase from January to March 24, we got 499 cases, and out of which we have 33% local transmission and 3 deaths. The case fatality rate at that time is 0.5%. And when the lockdown declared on March 24th, we got some time to improve our health system resilience, and we worked hard. And up to May 3rd, There was no other cases, and we are in a comfortable zone. And the whole world looked at us and asked, what is the method you used to contain this virus or to flatten the graph? And we explained what we are doing here. We are applying a scientific strategy to slow down the graph and to save lives, to reduce the mortality, case fatality rate. But after May 4th, it changed, and the lockdown lifted. The people from outside, from other countries and also from other part of India started coming back to Kerala. We have the large number of expatriates, as you all know. After May 3rd, 9 lakhs of people returned to Kerala from abroad and also from other states of India.
No, but ma'am, that is true, ma'am, with due regard, ma'am, with due regard, that is true of other parts of the country as well. Kerala is not the only state which got people coming in from different parts, whether it was migrants, whether in your case a lot of those who were living in the Gulf came back to Kerala. The fact though is that of the recorded 2.53 confirmed cases at the moment, 21,000 are linked either to international or interstate travel history. So a lot of the cases have risen within Kerala. Why have so many cases risen within the state?
Yes. Right. What you are saying is right. Because of the lifting of the lockdown, we should also have to announce some in the lockdown, and because of that we can start some work and other thing, and offices opened. But at that time we want that people should not gather. People should not be in groups, and gathering should be avoided and should keep 2-meter distance. And we started the break the chain campaign, that keeping social distance and also wearing mask, etc. But during that Onam season, some people didn't obey that, and there are some mass gatherings because of Onam celebration.
No, so did
and
you open? No, that's exactly. Sorry again to intervene. Did you open too early, ma'am? Sorry to intervene. Did you open up too early? Kerala tried to open up restaurants, tried to open up the state much earlier than many other parts of the country. Did you open up too early?
No, too early, because after central government declared the lifting of the lockdown, we should also have to do that, because we should have to protect lives and livelihood at the same time. But because of our vigorous campaign and because of our break the chain campaign and other strategy of testing, and that is why we can protect more lives this time also. The case goes to 2,58,850, but 1,67,256 recovered, and we have 90,000 live cases, but our case fatality rate is below 1%, that is 0.36%. I think it is shortest, or this is the good rate. We can say throughout the world it is above 1%, and case fatality rate 0.36% is a good sign.
No, I know that your mortality rate is low.
And good practice.
No, I take the point that your mortality remains relatively low, and that's a positive. But one final question: what about testing? According to reports, some reports, you're actually not testing as aggressively as you were a few months ago. Is that true, that compared to other parts of the country, Kerala also now seems to have lost that vigor when it comes to testing? Is there a sense of fatigue that has set in? Are you all tired after this long several months of battling corona?
No. We are applying a scientific testing strategy from the beginning itself, and we are following now also. In the first part, we applied that strategy, that trace, quarantine, test, isolate and treat. I think that is a scientific thing. We are approaching this virus, this spreading, this pandemic in a scientific way, not test, nothing else. But we are testing properly, and we gradually increased the number of testing also. Now we are testing more than 60,000 or 70,000 of samples per day, and that is a good number. And except from testing, we are adopting the proper method of isolating and quarantine, etc. We are giving proper treatment. We arranged more than 1 lakh beds to treat these people. And we have COVID first-line treatment centers and COVID
I
special
take that, but your test positivity rate, ma'am, your test positivity rate, your positivity moving rate, your increased recoveries compared to the rest of the country, you're moving in the wrong direction. Is there a worry? At the moment, are you worried, or is the situation fully under control?
No, we can say that we are enthusiastic. The situation is under control. But the test positivity rate increased because of this mingling or gathering of people after Onam, and also the protest rallies of the of some opposition, and also some gathering for some marriage, etc. The test positivity rate increased in the clusters, we can say so. And but we are keeping it below our health system resilience. We improved our health system resilience, and no one is laying behind without getting some treatment. Every people who were tested positive were admitted to the hospital, and we are giving proper treatment. 50%, only 50% of our bed is occupied in our COVID hospitals, and below 50%. And above 50% of beds are vacant, and ICU units are vacant, and ventilators are vacant. That means that we can provide good treatment to people who were getting positive afterwards also. And we are enthusiastic on that. Everyone is getting proper treatment. That is why we can reduce our case fatality rate.
Okay, well, that's reassuring to hear at a time when Kerala is once again under the scanner, this time for the wrong reasons. Shelja Teacher, Health Minister of Kerala, appreciate your joining me and speaking to me on the News Unlock. Let's turn from there to the larger picture, because the southern state is seeing the corona caseload increasing at a rapid pace. And as the Health Minister said, with the major festive months still ahead, some of them still ahead, the fear is that the cases will increase. So we ask the question, is the state's healthcare system really prepared to tackle the surge? Here's another report from Gopi Krishnan Onithan. Take a look.
It was on January 30th that India reported its first COVID-19 case. The patient was a young student from Kerala who had just returned from Wuhan, China. This was followed by 2 more cases within the next 4 days. However, the state managed to successfully treat all 3 patients, and it had 0 active cases by mid-February. This was gradually followed by a surge of cases across the country, till finally making India one of the global hotspots of the virus. But Kerala managed to keep the numbers under check initially, and was acclaimed globally for its containment strategy. At one point in early May, the state reported single-digit or no new cases at all. But since then, things seem to have taken an alarming turn, with over 10,000 cases being reported in a single day.
Kerala has the highest population density, most probably in India. And we have a lot of people, plenty of people, a huge number of people working abroad, and also people working in other parts of India. I think no other state will have that peculiarity. So the number of cases, the number of people coming from different parts of India as well as from outside, they have increased all of a sudden when the lockdown relaxation came into force.
So with the main festival season about to begin, the cases will possibly rise further. So the question is the state's healthcare system prepared to handle the surge?
The Infrastructure-wise, we have actually improved a lot in these years, these months. And the major issue would be the health resource, the human resource. The human resource is something which is very challenging. I must agree that it's still very challenging in Kerala because all the people who have been working for 8 months are actually stressed out. They have fatigue states in all these comes. We need to rejuvenate them on one hand and to provide more people for supporting the system.
We feel that we have to increase the number of tests to at least 1 lakh per day, so that we can move all those patients into quarantine and contain the disease. So at the moment it's a tough time, but we are trying our level best.
Most of the experts in Kerala believe that the surge in cases does not imply that the situation is critical in the state. Even as the total caseload crossed 2.5 lakhs, Kerala has managed to save more people than the national and global average.
And joining me now to find out whether Kerala can really push forward in this COVID battle, Dr. Matthew Kudalnadan, State President Kerala of the All India Professionals Congress, is joining me. I appreciate your joining us. Also joining me, Dr. Mohammad Ashil, Director, Kerala Social Security Mission. Let me come to you, Mr. Kudalnadan, because there's a sense that with elections coming up in Kerala in a few months' time, that this issue is going to get bigger and bigger. Do you believe that the government of Kerala mishandled COVID-19 because of these rising numbers?
See, at the starting, I would say I don't want to start with a negative note, because definitely we all are fighting this tough time. But of course, at this point of time, we all need to accept the fact that the success was celebrated too early, and now we are facing the real picture. So now, unfortunately, the cases is surging.
Kerala opened up too early? Do you believe Kerala opened up too early?
No, the celebration was too early. That's what I feel. See, and also there was many strategical problems or strategical misplacing happened in handling the cases. So when I say this, I would definitely admit and appreciate the work done by the health workers of Kerala and the tremendous effort given for fighting this pandemic. But at the same time, see, a couple of crucial issues which happened. See, the union government as well as the experts across suggested that it is always advisable to go for institutional quarantine. And before Kerala, when the initial cases were reported and when many NRIs started coming back, the state declared that we are fully prepared for institutional quarantine with the 2.5 lakh bed facilities for institutional quarantine. But then after once initially 10,000, 16,000 people arrived, and state realized that they are not able to handle the people coming in.
So you're saying the initial inflow was not handled. You want to respond to that, Dr. Mohammad Ashil? Because Kerala, in the months of May, June, was sort of allowing a lot of NRIs to come back home. That's where it started. That's where the triggering of process started. And now it seems to be going out of control.
One thing I must say in the beginning itself, that in a pandemic like this, the numbers of cases may be very deceiving. If you look at the zero surveillance data or zero prevalence data by ICMR last month, it really says that for every one case detected in India, there is at least 36 cases infections across. So that when it comes to Kerala, it's around 10 times. So when you see that the numbers of cases, it's not the real picture may not be very clear in that. So in a pandemic like this, when that too coming in one of the vulnerable state, because we have one of the highest proportion of elderly, we have one of the highest density of population, the rural-urban continuum. If you look at the study by many university, Kerala is considered one of the most vulnerable location for a faster epidemic, and that to a much epidemic with more mortality, because we have a demographic and epidemiological vulnerability for that. But still, as you know, we have been, for the last 8 months, we have been fighting.
Did you make any mistakes? I'm asking Dr. Mohammad Ashil, maybe this is a time to do a post-mortem. Is there something you could have done differently?
One thing which was pointed out was with regard to the home quarantine. If you see, in the initial, in March to May time, when the other states went for institutional quarantine, Kerala actually went for home quarantine. Why we actually opted for that is that we have a strong decentralized healthcare delivery system. So barging upon that, we actually did the home quarantine, and you know that. But the May first week, when many states were having an increased trend, we had new cases were actually 0 per day in May first week, and our active cases were just 3%. Then when a few cases came in, there was a lot of discussion between the scientific community whether you should go for institutional quarantine or you for home quarantine. This was a debate which has happened between the professionals in ICMR and Kerala also. When you see, and to the level that ICMR in the month of May, June said that we'll go for home quarantine rather than institutional quarantine, because that was more of an effective thing. But as you know, the number of cases would actually increase. But the only thing is, what is the numbers? The increase of cases should not be more than our health system capacity threshold. The moment it crosses the health system capacity threshold, like that happened in Italy, in the states in India, what happens is that the death goes very high. So in order to control that, it's a intelligent calculation of cases, intelligent calculation of numbers, intelligent calculation of the trend. So you need to increase our health system capacity threshold. For that, what we have done is in the last 6 months, we have added over 11,000 people into our system. We have increased our beds. We have increased our ICU facilities. We have increased our ventilator numbers. And as the Honorable Minister said,
I have 30 seconds. Why, sir, I have 30 seconds. Why is it that you have the third highest number of active coronavirus cases today? Something
yes,
surely...
Yes. Exactly, because we have delayed our peak. Actually, our peak, if many of the states have peaked earlier, so we are delaying our peak. And when looking at the numbers, as I said, the numbers can be deceiving because for every one case detected, there are more cases, undetected cases.
Okay.
So if you look at the trend, it's going to plateau around 20,000. We expect that it's going to plateau around 20,000. And our primary objective is to keep the death per million. The only count that would be looked after the epidemic is the death per million. And you see that our neighboring state, which has an epidemic started 43 days after that, have a death per million of 158, whereas we have a death per million of 27, having more vulnerability than the other states. I
take your point, Doctor. I take your point. The low case fatality rate you claim is the big achievement of Kerala, but the rising number of overall cases is something that you really should be worried about. Kerala cannot be complacent in this fight against COVID-19. Neither can any real state be complacent. I appreciate my guests joining me. Thank you very much. This was the News Unlocked, where we looked at a state which has something to worry about in the weeks and months ahead. Thanks for watching the news without the noise. Bye for now.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.